Our next topic, economic and social inequality, is an important one, and it's one that has received, I would say, increasing attention from economists in the last 20 to 30 years, particularly because inequality has been growing, as we will see. I also want to stress the importance of this topic because, as I will show you, it's really also a matter of life and death. Let's have a look at some data. This is an example of what is called the social gradient of health. That is, people's health, in this case measured by how long they live, is connected in an important way to their social and economic position in the society. So this is data from Statistics Canada, and as I think I mentioned in this class before, life expectancy really just measures the average age at which people are dying in a particular place. And in this case, what they've done is they've divided the country up into neighborhoods and ranked them from the highest income to the lowest income. And so what they've done is they've grouped these neighborhoods into what are called quintiles. So a quintile is a fifth. And so we've got 5 different groups, the lowest income up to the highest income group, and divided up between men and women. So you can see that men in the poorest fifth of the neighborhoods live to an average of 75.6 years, where in the highest income neighborhoods, they're dying at the age of 80.3 on average, at least in this range of years that we're looking at. And the interesting thing to note is that this is not just a sort of an issue that is confined to, let's say, poor people or people in the lowest income group. This is why it's called a gradient. So you can see that with every increase in income, as we go up for every fifth, people are living longer. So a gradient is just another word for a slope, and so that slope there is the social gradient of health. We have a look at women. We see that gradient exists as well, although it's flatter than for men, and I think that's generally true of many other examples as well. Men seem to be, in a way, more sensitive to social and economic status. Now, what sort of differences are there between these households? It's not just income, of course. People are doing different things in these places. Lower income areas are going to see more smoking, more drinking. People are more likely to be overweight. But those things might actually be a result of socioeconomic status. While they're certainly contributing to a lower life expectancy, they're not the sole cause of this. Other studies have proven that. Okay, so that's an example of the social gradient of health. My next example is a fairly recent one, which shows that the steepness of that social gradient can be changed depending on the nature of the society. So it's not something that is fixed in stone. Okay, well, this is kind of a complicated looking graph, so let's just slowly walk through it and see what's going on. What's being illustrated here on the left-hand side are the heights in centimeters of girls who are about 5 years old. And the data is taken from national surveys in 5 different countries. So here's our countries here, the Netherlands, Sweden, Australia, USA is this black one here, and here's the United Kingdom. And what we've got is these children ordered according to the level of their household income, the income in the household where they're growing up. Of course, they don't have any income themselves. They're only 5 years old. So this represents their parents' social and economic status. So households are essentially divided up into groups of one percentage point groups called a percentile, and we can lower them from, or we can order them from the lowest 1% up to those with the very highest incomes. So let's just have a look at one of these. So here's the United Kingdom, and this says the kids that come from the lowest income households, these girls, are substantially shorter, almost 2 centimeters shorter than the girls that come from the highest income group. And this slope, this gradient, is in fact a social gradient. So it's showing the height differences as the girls' household income gets higher and higher. And you can see that each country exhibits some gradient. But the interesting thing to note, or one of the interesting things, is that even the poorest kids in the Netherlands and Sweden are taller than the highest income kids in these other countries. What's going on here? Well, one thing, the critical thing that's going on from the point of view of the authors of this study that comes from this British medical journal called Pediatrics. The critical thing that's going on is that income inequality differs between these countries. Well, in the next set of slides, we're going to see how you can measure economic inequality using something called a Gini coefficient. But let me just say for now that these values that we see here beside each country's name is the value of this so-called Gini coefficient. And the lower that is, the lower is income inequality in that country. So the Netherlands and Sweden have the least amount of income inequality in this group of countries. And we can see two things. The girls are taller, and if you look at it carefully, you can also see that this social gradient, the difference between the incomes, the heights of the girls from the lowest income families and the highest income families is a lot less than it is in these other countries. So here it's about, looks like at most about a centimeter in the Netherlands, a little bit less than that in Sweden. Where in these other countries it's more like 2 centimeters. So the gradient is flatter. you might be wondering where Canada might fit into this. I expect that Canada would look rather like Australia, because our income inequality is rather similar to Australia's. I guess one more thing to add is that children's height, like this, is also a good predictor of their health later in life. So this is not just a matter of a centimeter here or there, but it's going to be an indication of how healthy they're going to be for the rest of their lives. Well, what we've been looking at is called the social gradient of health, and I've been just making the case that people's health is affected by where they are in the social and economic hierarchy. So this leads to the idea of what are called the social determinants of health. So how healthy a population is depends on all kinds of things that you might not expect at first. So it depends, people's health depends on their income and social status, as we saw when we looked at the data for neighborhoods. Turns out it also depends on their employment status. If people are unemployed, that's very bad for your health. And obviously, if people have poor working conditions, that can be bad for your health too. And I don't just mean working conditions where you're surrounded by hazardous chemicals or something like that. I mean working conditions in which people don't have much independence or autonomy in their work. They may have a boss who's watching over them all the time. I remember once opening a door at the university and finding a couple of the cleaning staff just sitting in chairs, just relaxing at the end of a hallway. And when I opened the door, they jumped up, obviously worried that they were being discovered slacking off. So being on edge like that is not good. Okay, education levels and literacy, that turns out to be connected to your health as well. Perhaps because it allows you to be better connected to the rest of society. People's childhood experiences, obviously important. That's what's causing the girls' heights to be different, after all. Physical environment can be important. Quality of housing, for instance. If you grow up in a place that's full of molds and unhealthy air, that's not good. Air pollution, for example, is often more heavily concentrated in low-income areas. Social supports are extremely important. Contact with friends and family. People who are more socially isolated are much more likely to die in any given year or to be unhealthy. Healthy behaviors are obviously important. Smoking and drinking is not good. I'll go on to give some further examples in a minute. Access to health services is also important. Now, of course, in a country like this, everyone in principle has access to universal health care, but access might also differ. Effective access might also differ depending on how educated you were, what your social status is. Are you able to advocate for yourself to get the treatment that you might need? Well, if people experience poor social determinants of health along these lines that I've indicated here, the theory is that their bodies are going to be suffering from chronic stress. It's just going to wear them down. And the long-term physical effects of that are going to make them less able to deal with health problems. Well, I'm going to end this here, and I'm just going to spend a few minutes giving you, in the next set of slides, an example from the United States, from a book that has just been published.